Hi everyone, I'm Laura, and I'm looking at the effects of nursing experience on diagnosing fetal position. So, certain positions of babies in labor can cause more poor outcomes for moms and babies than other positions. And one of the worst positions for a baby to be in is termed the occiput posterior position, or the OP position. And this picture shows you the OP position from the top of a baby's head looking through a mom's pelvis. The OP position is associated with really long labor, instrument delivery, excessive bleeding, stress, long hospital stays, among other things. So accurate diagnosis of fetal position is crucial so that healthcare providers can recommend the most appropriate interventions to women to help rotate these babies. So, for example, through position change or epidural, some of these things can help rotate the babies. Vaginal exam is the primary way that we diagnose fetal position. However, this depends on a lot of different factors, and the accuracy rate varies incredibly. So we do that by trying to feel the lines and soft spots on the baby's head there. So what I want to look at is whether labor and delivery nursing experience affects the accuracy rates of vaginal exam. And more specifically, I want to look at the amount of years worked as a labor and delivery nurse, a nurse's full-time equivalency, and the months of completed education they have, and how that relates to their accuracy scores. So I predicted that there would be a positive relationship between each of these variables in accuracy rates. So the more you work, the more often you work, and the more education you have, the better your accuracy scores would be. And by determining which factors are involved in accurate diagnosis, we can hopefully find methods to improve the skill and better health outcomes. So a convenient sample of 33 nurses from Abbotsford Hospital were asked to conduct multiple assessments of fetal position on my ward's dummy, mum, and fetus. So they would assess one position, turn around, I'd rotate the head, assess the next position, and so forth until they've assessed all 8 of these positions and gotten a score out of 8. I analyzed the results using bivariate correlation and multiple regression, and the bivariate correlation looks at the relationship between each of the variables. And what I found was that, as I predicted, years experience was positively correlated with accurate diagnosis. However, the full-time equivalency was not correlated at all with accurate diagnosis. And one potential reason I thought of for this was that on my ward there's a lot of frequent position changes among nurses. So you'll go full-time for a year, and then part-time, and then casual. And so there might be too much discrepancy there. Again, surprisingly, months of education was actually negatively associated with accurate diagnosis. So the more education you had, the less accurate diagnosis you got. And months of education was also negatively correlated with years experience. And I think these are related in the changes in nursing education over the last years. The programs have gotten a lot longer. So the most experienced nurses on my floor have the least amount of education because the program used to be a lot shorter. And that also points again to the top correlation where years experience is positively correlated with accurate diagnosis. Next, I looked at multiple regression to determine whether all 3 of the variables, predictor variables as a whole, accounted for a significant amount of change in the accuracy scores. Or in other words, how well does the linear model I proposed fit the data? And what we see in this graph here is a comparison of the accuracy scores I obtained compared with the accuracy scores predicted by the model. And when you see the pink line of fit there, intersects quite strongly with the blue null hypothesis to show at a glance that it is significant. And that was further corroborated by our analysis of variance showing significance. And it showed that the variables account for about 41% of the observed variance that we see in accuracy. Next, I analyzed the data using beta weights and uniqueness indices. And what these do is analyze the relative importance of each of the predictor variables, so experience, education, NFT, and accuracy. And unfortunately, none of the predictors had a significant influence on accuracy. accuracy scores. So there are a few limitations and maybe potential reasons for this lack of significance. Firstly, one idea is between the collinearity, which is when two of the predictor variables are highly correlated together, such as what we saw between experience and education. And sometimes when those are highly correlated, you won't have significant results because your variables are redundant. So a change in accuracy is already accounted for by a change in one of the other variables. Next, I had a small sample size, and with multiple regression, it usually relies on a sample size of at least 100 subjects, and I only had 33. So if I were to continue with this study, I think it would be really worthwhile to continue collecting participants to obtain more reliable results. Another limitation of my study is just the use of dummy patients, in that they may not actually reflect real-life situations, and that there are a lot of other variables involved in assessing fetal position. So further studies into the relationship between these variables, I think it would be valuable to do studies with larger sample sizes, like I said, even doing them over multiple sites to see whether there's differences in training programs across sites or other extraneous variables. Again, the use of live patients would also be really beneficial. And if using live patients, it would be really interesting to look at whether there's differences in difficulty assessing certain positions over assessing other positions, which obviously can't be done on a dummy fetus. So overall, when we looked at the regression as a whole, we found that the three predictors account for a significant amount of variance in accuracy. However, the beta weights and uniqueness indices, looking at each of the predictors, did not show any significance. Of most importance, perhaps, is the relationship
just
between...
stop the timer and continue at your own pace.
Between years' experience and accurate diagnosis. And so I just wanted some potential ways to deal with this in light of the experience and accuracy, is just to assign novice nurses more laboring patients, use mentorship or buddy programs with more senior staff, and using practice programs for novice nurses on dummy patients. Thank you very much.